GPs in their new commissioning role have a fantastic opportunity to redesign the way that we deliver services across both health and social care. So that means looking at a person's care needs across both their health care, their mental health, but also some of the social care needs that they might have. And it's really important to consider all of those different things when looking at the kind of technology that might support someone, even if it happens to be funded from one part of the health and social care economy or another. It can be very important to someone who uses those services that actually they're addressing their needs wherever the funding might come from. O2 Health is part of the mobile communications firm O2. It was formed in July 2010 to find better ways to deliver healthcare on behalf of patients, carers and clinicians using mobile technology. One of the things that O2 does best is connect people. It connects people through the mobile network, through the handsets that they carry. And one of the things we're doing with O2 Health is bringing that connection of one person to another to healthcare. So finding better ways of connecting clinicians and carers and patients.
O2 Health's vision is, broadly speaking, to enable healthcare providers to deliver healthcare services in new and innovative ways, and to do that by using mobile technologies that are broadly available in everyday life now. Part of the other priority area for us is to try to improve the experience of patients who are accessing healthcare services and enable them to become more involved in the planning and delivery of their care. Telehealth is the ability to remotely monitor patients who have an existing long-term condition. The way that's done is by using pieces of medical technology that can take readings and allowing the patient to essentially push those readings through into a system at the back end, and clinicians be able to pull that information down and interpret it and make decisions relative to that patient. It's beneficial because it means that patients can have more control of their care. They have more information about their healthcare condition on a day-to-day basis, and they can make appropriate changes to make sure that their condition is managed well. And it's beneficial for clinicians and healthcare systems because it means clinicians need to visit patients face-to-face less, so they create some more time in their working day to prioritise those face-to-face visits with the people who really need it. So you can drive efficiencies through the workforce, but you can also try to keep people independent and in their own homes for longer, therefore not consuming as much NHS resource as they currently may do.
The kinds of technology you see in Telecare are buttons for people to push if they need to call for help. They are things like fall detectors, and you also see support services behind those, so a group of specialised people who are able to respond to those alarms and alerts and to raise those to people who can then come and help. There are currently 2 million people supported by Telecare in the UK, and the Telecare industry allows people to live more independently in their own homes, to have a greater level of reassurance and support when they're at home. One of the things it doesn't currently do is allow people to step outside the front door, leave their homes and take that support with them.
Our solution uses tablet PCs and smartphones to enable people to be connected to their healthcare teams without needing to see them face to face. So what that means is patients are taking readings on a regular basis, they're answering questions around their health on a daily basis, and they're doing all of that electronically, which enables them to feel much more in control of their condition and much more empowered to make sure that what they're doing and the messages they're receiving are positively impacting on their long-term condition.
O2 Health's mobile care service, Help at Hand, means that you can take all of those things that you're currently used to from your Telecare service and leave the home with them. Help at Hand is 3 things working together to deliver a mobile care service. One of those things is a mobile handset, like a small mobile phone, which allows you to call for help for a number of different reasons. You can set that up using a website. Just gives you complete control of the service. You're able to set it up exactly as you want, tell us who you want to respond in certain situations. And all of that is backed by a support centre who can see your information on screen and can react according to the things you've put onto our website. If you're someone who uses Help at Hand, there are a number of different things that it can do for you. The Help at Hand online service can be made specific to your care needs. Help at Hand has GPS technology to find you if you need help. It has a fall detector that can detect a fall and call for help. It has safe zones, which means you can set a zone around an area and get an alert when the handset moves outside it. Our handsets include a support button, which means you can connect in one touch with a specialised team. We provide 24/7 support, which means you can connect to a specialised support centre that can help when you need it. And all you need to make the service work is an internet connection and mobile network coverage.
The Department of Health has targeted the NHS with saving £20 billion by the end of the financial year 2015. This is even though there are going to be more demands on the service, ageing population, more long-term conditions coming on board, more stress on the beds, staff as well. The NHS Chief Executive has suggested that with the CCGs coming on board, now is the time to move forward with productivity and quality in the service rather than dealing with the service that it has been currently and in the past. In order to achieve this change, the Commissioners are going to have to use informatics and technology information in a better, more efficient way. They may feel some more administration will be involved and they may not want to do this, but actually we can show them ways that their administration will be reduced, giving them more time to care for their patients. By commissioning telehealth services, the GP practice will be able to take pressure off of themselves while also giving autonomy back to the patient.